Providers can use our platform to target patients that may be at risk for a proactive outreach, and our bot technology has a conversation with them, and we have a very good understanding from a care navigation perspective of where they need to go.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. I'm here today with Jerrod Ullah, CEO and founder at HealthTalk AI. Jerrod, great to see you again.
Great to be here. Thanks for having me.
So it's been a few years since our last interview.
Yep.
I've been just excited and proud to see your company grow, and you're trucking along. You're growing each year, which is its own sort of badge of honor in healthcare. Is that right?
Yeah, absolutely. It's persistence, and you have to be able to be flexible and not necessarily, hang on to your absolute vision. You got to listen to your customers, listen to the market, and as long as you can pivot and solve those problems, you continue to add value to the community we serve.
Yeah. All right. Well, so give me the pitch. What's HealthTalk AI today?
Yeah, HealthTalk AI is a patient engagement communication platform that allows patients to seamlessly gain access to providers. And they do that, in a myriad of different ways. Providers can use our platform to target patients that may be at risk for a proactive outreach, and our bot technology has a conversation with them, and we have a very good understanding from a care navigation perspective of where they need to go. And I think the last couple of years, what we've done really well is lean into that AI scheduling component, where we're using, we have a partner with Redox, and so which has been really great, and that allows us to be integrated to 90 plus EMRs on the back end.
Got it.
So that really allows us to gain insight, our virtual assistant bot gain insight to the schedules and the access to the supply of providers that patients don't easily have access to.
Okay.
Right, and so whether that's a discharge follow from a hospital or an annual wellness visit, patients gonna get the access they're looking for just by, it's a text to treat model.
Okay. So let's put a face on it. Let's get really practical. Let's say I'm a patient within the catchment area of a clinic that's using HealthTalk AI. How do I use the system? What's it like for me?
It's very simple. You text your provider's phone number, and we will greet you with your name if you've been there before. If not, you will be kind of pre-reg via text into whatever EMR they are. And then from that, our customers have set up think of it as digital access points, things that they can do via text, whether that's set up a telehealth visit, set up an on-demand telehealth visit, whether that's schedule a vaccine or schedule an in-person visit. And then our AI kind of takes it from there to get them to where they need to go and get them scheduled to them.
What are some of the time and cost savings that you are excited to be able to share with a new customer?
Oh, the impact is great. Like, for example, we're working with a hospital in New Jersey where we are engaging, I think it's 800 patients a day.
Really?
And we're actually taking them from the ER. The bot is assessing their clinical trajectory and whether they have a primary care provider, and we're actually able to schedule them into ECW in this case, and we're doing 30 or 40 a month. So those are patients that don't have primary care providers that we're seeing in the ER, and based on the bot technology, we're able to retain those patients, and more importantly, they're getting access to primary care in days instead of months or weeks or ever.
It sounds like you're getting pretty good engagement in a market that's really struggled with engagement.
Yeah, it's because it's targeted, right? It's an automated way. The patients are being there's nothing the provider has to do. We essentially are getting that list from the provider post-discharge, and they may be targeted based on diagnosis. They may be targeted based on criticality of the visit, and we know a lot about the patient based on what we're getting from the EMR. And then essentially the engagement, it's easy. It's in their language. We support all languages.
Oh, wow.
That was really important for me during COVID. So the bot are configured in any language. So that's really important because the patient is engaged the first time in their native language.
How difficult was that to get off the ground?
If folks that develop software understand, it's very difficult to be configurable yet scalable.
Okay.
So it was a big investment for us. But it's been well worth it because now we can go into a region that, may speak Mongol or Creo, and it's something that we can do a really good job with that patients. Even though the patients are 2%, those patients matter, and we have to be able to meet those patients where they are.
Yeah. Now,
Yeah.
now you're coming at your role as CEO as having been a healthcare provider, right? You
Yep.
worked as a nurse. How do you feel like that impacts how you lead this company today?
Yeah, I think being a clinical founder, I used to be a neonatal intensive care nurse many years ago. I think it does help me keep it grounded in terms of what it's like to use our tools from a provider. So we're very minimalistic from that. I mean, we are trying to allow the EMR to kind of be the source of truth as much as we can for providers. We don't want to make it as easy as it can for them. So I think it does help from that perspective. Obviously I understand workflows and things like that are critical to kind of making sure that they're sustainable, if that makes sense.
I'm guessing it helps just in your conversations with potential clients. You're like, I've been there, I get it.
Yeah, absolutely. It helps. I mean, I think it potentially helps with their credibility, but I think it's also they know that I care. I mean, I
Yeah.
think we're all into it for a purpose, and taking care of patients is definitely something I'm proud of.
Yeah.
Yeah.
Something I'm interested about with Health Talk is that you've been grinding away, you've been gaining these clients, you've been doing the work, and you're in this market that, from my perspective, is getting crowded in terms of just thinking about AI-assisted navigation.
Yeah.
And I see you as someone who's out there doing the work, and there's a lot of people talking about it. And I wonder what you see as the distinguishing factors between the companies coming into that space, between the ones that are going to succeed and the ones that are going to fail.
It's a really good question. I think if folks are thinking about AI, I named the company HealthTalk AI 7 years ago, and it's hard to believe. But I had a fundamental belief that because of the shortage of resources on the provider side, and because patients is difficult to gain access, I knew that AI would have an impact. Now there's a little ton of companies, like you said, with AI. I think it has to be actionable. I think at some point generative AI will have a component to what we're doing. In the future, I think it will. I think we're looking at that, all the time about that. But it has to have particular problems, and not this kind of ambiguous.
Black box.
We using AI. We're just AI. Our bots are very specific. They're very specific tasks and what they do. Yeah. And I think what's great about Health Talk is that, we have a set of content that they can start from day one, but they really have the ability to build their own bots based on things and problems in the future that they don't know about. So we kind of future-proof it that way. So they have the keys in the kingdom to build things on their own without having to come back to us and saying, Jerrod, we need this, we need that. They have the ability to kind of problem solve on their own.
Interesting. So what I'm hearing is that there's also just like a clarity of solving this problem with this tool versus a sort of a nebulous, well, our generative AI can do everything.
Yeah.
You are tackling specific, and that goes back to your experience as a healthcare provider. Yeah. Like a specific problem needs a specific solution.
You have to have an outcome. So, for example, a readmissions. If a provider has a problem with readmissions, we'll say, okay, let's attack that. Let's engage your high-risk patients. Every patient is going to be engaged post-discharge in their native language, and we're going to assess their trajectory, and we're going to give them the access to care virtually or in clinic the next day.
Yeah.
So, but that's all our bot does, is we're focused, and then over time, we expand that, and okay, let's talk about problem 2, problem 3, problem 4, if that makes sense.
Yeah. No, I love the sort of the clarity and focus of it.
It's easy for our clients to say, okay, we understand the value that HealthTalk is providing, right? Because we're aligned with their top priorities.
Okay. What are you most excited about for the next 12 months in terms of growth or milestones?
Well, I think I'm most excited if folks are interested in AI now. I think that's the thing, is like, I think at this point, people understand that for a long time, I think as clinicians, we used to talk top of license. In other words, you need registered nurses doing these set of jobs, you need front-end desks doing these certain type of jobs, you need physicians doing this, but there's a new layer now, and it's what AI should be doing first, right? And that is things that humans are not good at, or jobs that humans do not want to do, right? So we should be thinking of that layer first, and that's where companies like HealthTalk AI can really fit really well, right? And we can add a lot of accuracy, we can add a lot of value in that, and then we can talk about the rest of the folks that are left after the Great Resignation, right? That the rest of the folks that now we can go back and say, okay, what are the new jobs that nurses are going to be doing? Because nurses shouldn't be dying for dollars every day. They shouldn't be doing that anymore.
Yeah.
Whether they use HealthTalk or somebody else, they should not be doing that. They should be taking care of patients. I'm passionate about that. So there's a new layer that I think that people are understanding that I'm really excited about.
Okay. Who's an ideal partner for you going forward?
In terms of a customer?
Yeah.
Yeah, I think we fit really well in the primary care space because of flexibility of our platform, to being able to do an outreach for diabetes or doing an outreach and scheduling for annual wellness, or patients just being able to text or treat for a pediatric visit. So because there's so many different use cases, we're a really good fit there. But I think that healthcare and health systems or provider systems are a good fit too, just because we can automate so many of their processes that they're using, manual or human power now, that really they shouldn't be doing. They haven't really figured out they can't afford to be doing for very long. So those two segments I think are good partners for us.
Jerrod, I appreciate you taking the time with me. I love seeing how your experience at the bedside has informed this company. I talk to a lot of founders, and I don't always get that. The immediacy of understanding the patient experience and the clinic experience, and the fact that you've been pushing on this for, we said 7 years?
Yeah.
Kind of before all this generative AI conversation was so hot, doing the work, really helping folks, and growing steadily each year. It's exciting to watch. So thanks for stopping by.
Thanks for having me. I
All right.
appreciate you.
Thanks, Jerrod.
Yeah, Logan.